Tazarotene is widely used both in the treatment of skin ailments like psoriasis or dermatitis and in cosmetology to reduce wrinkles. The drug is characterized by low toxicity and causes a minimum of irritation. This is explained by its low absorption. The substance does not accumulate in the skin or fatty tissues. Indications. In fact, Tazarotene is prescribed for all skin ailments caused by vitamin A deficiency, failures in the regeneration process, and some autoimmune ailments. Tazarotene is especially effective in psoriasis, an autoimmune disease that causes dry, scaly patches to form in the skin that form large plaques. However, it is effective only in relatively mild forms of the disease. The drug is used in the treatment of ichthyosis, a skin disease in which the process of keratinization is disrupted. Apply ointment in the treatment of scars and acne, due to the ability of retinoids to accelerate the regenerative process. The drug is used in the treatment of acne, especially with oily skin, as Tazarotene suppresses the excessive activity of the sebaceous glands. In cosmetology, retinol is used as an anti-wrinkle agent. Its effectiveness in this case is also due to the ability of accelerate the recovery process. The ointment is also used for photoaging, as it stimulates the production of melanin. How to use. For acne breakouts. As a rule, the drug is prescribed for patients with normal or oily skin. With dry skin, it is necessary to combine the ointment with glucocorticoid preparations that can eliminate the irritating effect of the retinoid. Before use, be sure to clean the skin of the face. They use the usual means, but it is advisable to choose those that do not contain alcohol and therefore do not dry. For dry skin, it is advisable to first lubricate the affected area with a moisturizer, and after it has been absorbed, to use a healing ointment. A thin layer of Tazarotene is applied to the affected area, wrapped in the gentle massaging movements until completely absorbed. The volume of one dose of ointment is comparable to the size of a pear. You should avoid getting the cream on the area around the eyes or mouth, as the skin is too sensitive here. It is recommended to carry out the procedure in the evening before going to bed. The course usually lasts 4 to 5 months. In the first week, the ointment is used daily. When the effect is achieved, usually after 12 weeks, the frequency of the procedure is reduced to 1 to 2 per week. For ichthyosis and psoriasis. In this case, skin damage is noticeably stronger and more dangerous, and therefore the drug is used in a slightly different way. The dose and dosage form should be chosen by the doctor. The ointment is applied in the usual way, a thin layer on the affected area. Rub the cream almost until completely absorbed, trying to avoid painful sensations. An important limitation is the maximum dose of the substance, no more than 2 mg of the active substance per 1 square cc skin, as well as the maximum area of the body on which the ointment can be applied, no more than 12%. Avoid applying the cream around the eyes and mouth. For dry skin, always apply a moisture first. The procedure is carried out 1 time per day, usually at bedtime. The course lasts at least 6 months. Usually the result becomes noticeable after 10 to 12 weeks of use. Be sure to apply sunscreen before going outside. Contraindications. Tazarotene is bound to cause some skin irritation, especially in the first weeks of use. This feature is one of the main contraindications for use. Pregnancy and lactation. Although Tazarotene is not a glucocorticoid, it has a strong effect on the skin, and the reaction of the skin at this time is unpredictable. There is a high risk of developing allergies. Children under 12 years of age are prohibited from prescribing this drug for the same reason: the risk of an allergic reaction. Open injuries, wounds, severe burns, ulcers. Photosensitivity. Excessive sensitivity of the skin to ultraviolet often causes inflammation. Retinoids enhance this property. With rosacea, the drug is also not used. If there is an allergy to any components of the drug, it is prohibited to use it. Special instructions. To minimize possible side effects, a number of recommendations should be followed. The doctor should select the dosage, both at the first stage of treatment and to prevent relapses. You cannot apply the cream to the area around the eyes or mouth, and even more so to allow the ointment to get on the mucous membranes. The irritation will be very strong. If the medicine causes severe itching, redness or peeling, the number of procedures is reduced or the concentration is reduced. However, this decision may also be made by a dermatologist. During treatment, you need to abandon any kind of care products that dry the skin, alcohol-based lotion, soaps. It is necessary to avoid exposure to frost, strong wind, intensive solar radiation. The use of sunscreen is essential. Side effects. A common side effect of Tazarotene is irritation and redness of the skin during the first stages of application. As a rule, there is also itching. The skin is noticeably dry and flaky for the first 2 weeks. Almost no one manages to do without this stage. The ointment can cause rash. The application of the cream may be accompanied by a burning sensation. If such symptoms persist for no more than 3 weeks, the drug continues to be used. However, Tazarotene can also cause more severe side effects: contact dermatitis, eczema, an increase in psoriatic plaques, the appearance of local inflammation and swelling. In this case, the use of the drug should be abandoned.